Hello everybody, my name is Armando Luis. Today we are going to talk about cultural, spiritual and other preferences that patients in our facilities may have and how to address it. Personal values and morals are formed over time with life experiences and development, while culture refers to values and social roots. When nurses enter the profession, there is an expectation to uphold legal standards of care, as well as moral and ethical codes of practice to provide the best quality care to our patients. In the United States, we have the American Nurses Association Code of Ethics. It defines the ethical obligations for the profession, and on the other hand, we also have the Hospital Ethical Committee. This one sets autonomy, beneficence, and justice as its premises. Autonomy is the patient's right. Example, informed consent. Beneficence consists in our actions as nurses. These actions must promote good. And justice refers to the fair and equal treatment that must be provided to all patients no matter what. In our nursing assessment tool, we might find questions about race, ethnicity, and religion. Other specific boxes are designed for preferences, such as type of foods like kosher or regular. Additionally, patients can choose between male or female nurses, for instance, in the case of Muslim patients, where only a same-sex nurses should be allowed to examine them. Cultural and spiritual preferences are also taken in consideration when we ask for advance directives and DNR, do not resuscitate. Here, with these two options, we address organ donation, end of life, power of attorney, and resuscitation are not preferences. One example that I can recall from a personal experience that indicates cultural and spiritual preferences is the refusing for a blood transfusion on a 6-month-old baby in a pediatric unit. The parents both were Jehovah's Witnesses, and in this particular situation, the medical personnel had to respect their preferences. As an alternative, volume expanders and fluids were used instead to treat baby. Another example is when a patient coded while I was doing my rotations in the OR, operating room, regardless of this patient DNR, did not resuscitate in the OR, the physician and nurses resuscitated the patient. And the reason is that when a code is caused by the hospital, there is an exception and the patient must be resuscitated. As we can see, nurses play an important role in maintaining the integrity of our patients' cultural and spiritual beliefs. Nonetheless, there is always room for improvement, and who better than nurses that are in direct contact with the patients to assist and regulate the guidelines for cultural and spiritual preferences. Thank you for watching.